So this discussion is going to focus on muscle building agents used in sports. So it's going to complement the information used in Chapter 11. We're going to be discussing some of the muscle building agents, or what your textbook classifies as muscle building agents, in the chapter on supplements. So we're going to focus on very specific muscle building agents used in sports in this discussion, and bring up some of the other things that aren't discussed in this discussion in the chapter on supplements. So the muscle building agents that we're going to be looking at, steroids, anabolic androgenic steroids, talk about them, and we're also going to look at human growth hormone and human chorionic gonadotropin. So these are going to be the compounds that we're going to be discussing in this section. Your textbook talks about some other muscle building agents. The muscle building agents that we don't address here, we'll be looking at in the next discussion on supplements. So the steroids we're going to be discussing here are different than the steroids we talked about earlier in the semester. Earlier on in the semester we discussed corticosteroids. What we're going to be looking at here are anabolic androgenic steroids. So the two different parts to that. We're going to be looking at, so you look at this and break it down. Androgenic refers to male sex characteristics. Anabolic refers to the enhanced tissue metabolism that you get. Now we're looking at here is the production of testosterone. So both males and females produce testosterone. Males obviously produce more than females, and we'll talk about why that is. And in females, a lot of the testosterone starts as androstenedione. The steroids we're going to be talking about here are on the controlled substances list. They are classified as a Schedule III drug. So testosterone in the body is carried by the blood in one of three ways. You have it carried via sex hormone binding globulin, where this form is not readily available to the tissues. So 30% of it in males and 58% of it in females are carried in this fashion. Another way is that when it's bound to albumin, and it's loosely bound. So that's 67% in males and 40% in females, and then the remaining is free testosterone, so it's not bound to anything and is completely readily available, and that's 3% in males and 2% in females. So when you look at the percentages here, you look at the loosely bound and the unbound, more in males is more circulating testosterone in males versus females is readily used for tissue and other ways of the body. So, one way this can be seen is through the outward secondary sex characteristics in males. So males have not only have more testosterone, but they also have more available for utilization by the body. So some of the basic science behind anabolic steroids, we kind of look at the physiology here. Now, all of your steroids are derived from cholesterol. The way it kind of works is the hypothalamus secretes gonadotropin-releasing hormone to the pituitary. The pituitary then secretes follicle-stimulating hormone and luteinizing hormone, which then secretes the gonads to produce testosterone. All of this is done through and regulated in the body through what's known as a negative feedback loop, meaning that once testosterone levels in the body are deemed sufficient, the body will decrease the secretion of GnRH, FSH, and LH. So that's what it means by a negative feedback loop. So if you remember going back to anatomy and physiology, you have negative feedback loops in the body, and this is one of those. So once the testosterone levels are deemed sufficient, those other hormones will decrease. So the uses of anabolic androgenic steroids, there are what are deemed legitimate medical purposes for these, and we have some of them listed on here. A lot of them relate to hormone problems, particularly in males, but there are some other types of treatments and uses for the anabolic androgenic steroids. Obviously, what we're primarily focusing on in this discussion are the non-medical purposes primarily used ergogenically for athletes to build up muscle strength and muscle bulk. Table 11.1 in your textbook describes some of the common types of steroids used by athletes, and I have some of them in tables here as well. The steroids used, the anabolic androgenic steroids utilized for muscle bulk and strength purposes come in both oral and injectable forms. There's other forms of testosterone supplementation, but these are really the most effective type for improving these characteristics. There's 3 methods utilized that individuals who will use steroids will utilize for these purposes. One is known as stacking, and that's the use of more than one steroid at a time, and a lot of times some of the drugs used within the stacking processes will be used for reducing some of the side effects related to the anabolic steroids. Another one is known as cycling, where individuals will use and then discontinue the use of the steroids, and another form is what's known as pyramiding, where an individual will taper down in dosage from the steroids that they're using. So in your textbook, tables 11.2 and 11.3 show examples of steroid cycling. So you can see here, and I'm not per se going to be looking to test you on, what's the milligrams per week that they use in cycling purposes. But again, I do want you to know types of steroids that get utilized. This just shows an example so you can kind of see, again, not taken from the most scientific resource per se, and again, a lot of times some of the knowledge of this is not necessarily built on scientific evidence, but just kind of shows you an example of the use of some different types of steroids and kind of how they cycle down from the dosage and discontinue the use. I don't have the other table for this in this discussion, but you can refer to your textbook for that as well. Again, just some perspective, looking at some different types of steroids and kind of what they typically get used for. So you have what's considered the best steroid for defining muscles, so individuals involved in physique-based sports, bodybuilding, and the best steroids for size. Again, refer to the tables in your textbook, and as far as some of the other versions and the way in which they're administered. Here you see both the brand name and the generic name of the steroids used for these particular purposes. One note on a particular type of anabolic steroid, THD or tetrahydrogesterone, is a synthetic steroid. So this is a modified steroid, very similar in chemical structure to gesterone and trenbolone. This was a steroid in the early part of the 2000s that became very popular, partially because it was undetectable on urine tests, and at the time it was deemed an unapproved drug by the FDA. So this is another, so when you hear either the term a synthetic or a designer steroid, THG would fall underneath that classification. So the physiological effects of anabolic androgenic steroids, it's been very difficult to establish through scientific research processes, but we do know some of the physiologic effects have been kind of confirmed over the years. Decreased reflex times, or decrease in reflex latency times, which is a good thing because that's obviously makes people be able to react faster. And we know about the increase in overall size, partially one because of the increased protein synthesis, and the other is the ability to exercise for longer periods of time, improved recovery abilities. You also have increased fat-free mass, hypertrophy of muscle fibers, and increased bone remodeling. So we know that the benefits to increase the size and the tissue in the body is partially the reasons why a lot of individuals will utilize this. Now, some of the effects, or purported effects, are not necessarily, or less proven. So, in particular, the aggressiveness, or what we commonly known as roid rage, is really not a proven physiologic effect of anabolic androgenic steroids. So, a lot of the more psychological-based things related to anabolic androgenic steroids haven't been proven in research. So now, could they become secondary to other aspects of the benefits? In other words, do just people who get stronger through the use of steroids, does that inherently make them more aggressive? That could be something. But as far as the direct link, again, the concept of roid rage is something that is a little more I guess, for lack of a better way of putting it, maybe more media-driven or more anecdotal than we initially thought. So in looking at the adverse effects that we know scientifically that do occur with anabolic androgenic steroids, we're going to look at those. So we're going to break them up into the general adverse effects, and then we're going to look at what specifically happens in males versus females that becomes an issue with the use of these drugs. So the first is blood flow gets compromised in the cardiac tissue. There is an increased risk of myocardial infarction. You see a lot of things with the cardiovascular system happen. For instance, a decrease in HDL cholesterol, an increase in LDL cholesterol. So the good and bad cholesterol, if you will, get thrown out of proportion. Impaired right ventricle contraction, impaired diastolic function of the cardiovascular system, and then you have increased risk of heart failure and stroke. So other cardiovascular effects that you notice with this. They're very toxic to the liver, particularly oral anabolic steroids, and that's because of the first pass metabolism. A lot of individuals also end up suffering from kidney dysfunctions from the filtering effect, and then the hyperinsulinism, again, from combination of the some of the other effects, increase in HDL, or a decrease rather in HDL concentrations, and an increase in blood pressure. So a lot of people kind of understand, again, just through hearing things, some of the particular effects to the different genders. So the adverse effects in males that you find, you have a reduction in testicular function, breast development or the gynecomastia, male pattern baldness, severe acne, prostate enlargement, impotence in a decrease in libido, glucose intolerance, and tendon rupture. So again, from taking the testosterone, the body then stop utilizing and developing its own. So it's part of the reason for a lot of the adverse effects when you look at the use of anabolic steroids in males. And then the adverse effects in females. So, in general, when you look at this, you see males taking on more female characteristics. You see females taking on more male characteristics. So a lot of the masculinization effects, the facial hair, baldness occurring also in females, the deepening in the voice. Obviously some of the changes that will start to occur with the menstrual cycle, again, because of the increase in circulating testosterone. One thing to particularly note, in females, a lot of the changes are irreversible. So once the changes take place, they are irreversible. Unlike some of the potential changes that occur with the males, with the females, many of them cannot be changed. So what was discussed earlier is how individuals will take a lot of other drugs with the steroids on top of just stacking multiple steroids. Some people will take certain drugs to kind of counteract the adverse effects. So some of those are listed here. Clomid, which is an anti-estrogen. Many females will actually take Clomid to help them get pregnant. Individuals will take Clomid with the steroids as a way to decrease, particularly with males. Males will take Clomid with the steroids to decrease some of the potential adverse side effects in taking on the female characteristics. Some males will just take Clomid as a standby by itself to kind of sort of get the anabolic steroid effects, but without taking steroids. Accutane and Propecia are just examples of other drugs utilized for some of the other side effects related to taking steroids. So another thing taken by individuals for performance-enhancing purposes and for muscle-building purposes is human growth hormone. So human growth hormone is an endogenous hormone. It's produced by the pituitary gland. Its functions are to facilitate amino acid transport, which increases protein synthesis, and it also helps to maintain blood glucose levels and assists in releasing fatty acids from the fat cells in the body to be utilized as energy. So people will take extraneous human growth hormone to help facilitate some of these functions. So here's a flow chart showing you how the body will produce human growth hormone. So the hypothalamus secretes growth hormone releasing hormone, GHRH, sends that to the pituitary. The anterior pituitary gland will secrete growth hormone. That will stimulate the liver to produce IGF-1 and somatostatin. Those then stimulate the tissues in the body to increase in size. So it stimulates muscle, bone, and then stimulates the energy releasing mechanism from fat cells. So this is kind of how one, growth hormone is released in the body, and two, then kind of how it gets utilized in the body through the release of other substances. So a couple things to note about human growth hormone, and some of this will explain part of the reason why individuals will use human growth hormone as an ergogenic aid. One thing, it does affect all body systems. So you typically think of people using human growth hormone to, again, increase muscle size and increase strength. But it affects all body systems. So when you take it, it could increase activity and growth throughout the body. Some other things that occur with human growth hormone: it facilitates the transport of amino acids, causes hyperplasia. So again, the difference between hypertrophy and hyperplasia when you're looking at muscle is hypertrophy is an increase in the size of the muscle fibers. Hyperplasia is a splitting and increase in number of the muscle fibers. So it does promote that. It also promotes lipolysis, or the breakdown of fat. Again, that could be utilized for energy purposes. It increases calcium retention, and again, it utilizes the amino acids in the body. So again, it could help with some of that protein synthesis. So the question becomes, why use human growth hormone? Well, a couple points. It's non-detectable via conventional drug testing. So that's one of the things that made it very popular. There are also now synthetic versions of it as well, so there's been advancement in human growth hormone, very similar to what's happened with anabolic steroids, and it basically produces a lot of the steroid-like changes in the body that we think of: increase in muscle size, decrease in body fat, those sort of effects. So that's part of the reason why human growth hormone has become so popular as an ergogenic aid. The adverse effects of human growth hormone, I have these listed here. I'm just going to talk particular about one of them, acromegaly. Acromegaly is actually a condition that some people have where they actually just produce abnormal amounts of human growth hormone. So obviously if an individual is taking some that's not produced by the body, it could happen as well. And this is where, saying earlier how human growth hormone affects all body systems. So an individual that develops acromegaly, they tend to have a very large body, so their body frame and everything, very large hands, very large skull. People who have acromegaly typically don't live as long as the average person, just because their body's so large, it's hard on their entire system. So that's one of the adverse effects. Some of the others listed here, again, related to the cardiovascular system, the respiratory system. You see all of those present within the adverse effects. As with the anabolic androgenic steroids, there are other uses in medicine for human growth hormone. So in a lot of individuals, younger individuals who have improper growth, sometimes use human growth hormone to stimulate growth, and some older people will utilize it to help maintain youth. So for people who become deficient in it, it could be utilized as well. So here's what we find with some of the information on human growth hormone. So we know that individuals have a decrease in fat, they have an increase in muscle mass. There's no direct increase in strength. Now, again, whether increases in strength will come by virtue of some of the increase in mass and some of the increased recovery ability, but there's no direct increase in strength through the use of human growth hormones. That's something to keep in mind. You don't have the neurological issues, for instance, like with decreased reflex latency and things like that contribute with those things that with anabolic steroids. You don't get that with HGH. You also get improved bone density and improved lipid profiles with human growth hormone. And again, the improved bone density just comes again by virtue of the effects of human growth hormone on all the tissues in the body. So that also includes bone tissue. HCG is the last thing we're going to talk about. So human chorionic gonadotropin. It is a hormone similar to luteinizing hormone. The effects that you have in males and females, or what human chorionic gonadotropin does in males and females. So for females, it stimulates ovulation in the ovaries, and in males, it stimulates the testes to produce testosterone. So it has those effects in males and females. Again, it kind of mimics what luteinizing hormone does in individuals. Now, for ergogenic and performance purposes, where you see HCG getting utilized is in particular in combination with anabolic androgenic steroids. So they'll use it post cycles to help the body. If for males, they'll help to boost their body's own production of testosterone. And what this will do, particularly for males, is restore testicular size as well. So we know that the anabolic androgenic steroids will cause a decrease in testicular size because of the suppressing effects that occur after a while of the body's own natural testosterone. And with this, the hypothalamus will also shut down of gonadotrophic releasing hormone as well. Now, there was a lot done with the use of human chorionic gonadotropin in weight loss. It's a controversial topic. A British endocrinologist actually studied this. He used HCG to supplement a low-calorie diet, and they discovered that individuals on these low-calorie diets lost more body fat and maintained lean body mass. Now, an interesting thing to note is that this will only work with injectable forms of human chorionic gonadotropin. They actually do sell HCG over the counter in liquid form to do in sublingual fashion, but that form is not effective. The only way it's going to be effective is if a person uses an injectable version of this. So the over-the-counter products that you'll see over-the-counter sold in stores that can be used where you drop it underneath the tongue, those are not effective for these purposes. So like human growth hormone and anabolic androgenic steroids, HCG is also banned in the NCAA, the International Olympic Committee, the NFL, and Major League Baseball as well. So it is banned as a substance in all of those various sports. So here's the discussion question. Just one question for the discussion board. So what would you do if you knew an athlete was taking anabolic steroids? So you as the athletic trainer, well, what would you do if you were aware of this? Again, knowing what you know, obviously knowing that they're banned substances as well, in addition to all of the other health effects that taking an anabolic androgenic steroid would produce. So this is the end of this discussion. Again, make sure you read your textbook as well to kind of complement this. I did add in some other things, particularly related to human growth hormone, and I also talked about HCG, which is also not in your textbook. So read the information in your textbook. As I said, the other supplements that this chapter discusses, I will be including in a separate supplement discussion. So we will talk about those, looking at those in next week's as next week's topic.